Hello kids, welcome to the class. Today we are going to start new topic safety and the first aid. Now today you see accidents are becoming very common. Accidents are caused most often by carelessness. Accident can happen anytime anywhere. So it's very important to know about first aid. There are different types of first aid for the different situations. So, first, understand what is first aid. It is a basic medical help given to a person who is injured before the professional help reaches him or her. Accident at home. Many accidents occur at home. The major causes for the accident that happen at home are sharp items, stoves and matchsticks, and electricity. So the person has to be very careful while handling all these things. Fire accidents. The fire accident can cause severe damage to the things and life. The causes of fire accidents are kitchen fire, electrical short circuits, open flames, playing with fires, and flammable products. So let's study kitchen fires. It occurs when people leave their burning stoves unattended. This can cause a great damage. The prevention for it are be attentive while cooking, keep the LPG cylinder in a ventilated place, keep away hand towels from the heat areas, do not wear loose and synthetic clothes that can catch fire easily. Electric short circuit. It occurs when wires or the circuits become overloaded due to the increase in the current. The prevention for it are check your electrical appliances regularly, repair or replace the damaged wire, do not run electrical wires under the rug or furniture, open flames. It is one of the cause for the fire accident. It occurs when the burning candles or lamp are placed near the flammable materials. The prevention for it are blow out the candles before leaving or when not in use. Place the candles on a sturdy holders. Keep the candles away from the flammable materials. The next cause for the fire accident is playing with fires. It occurs when children play with fire. They tend to play with matchsticks. Again, it can be very dangerous. The prevention for it are be careful while using the matchstick. Never play with fire. Keep all the lighters and the matchsticks away from the children. Ways to put out fire. So let's study them in detail. How we can put out the fire. So first, make use of the fire extinguisher or a sand. During a gas leakage, switch off the burners and the knobs of the gas supply. If the person catches the fire, a thick blanket should be wrapped around him. So these are the ways in which the fire can be put off. Burns. It is caused by the fire accident, hot objects, hot liquids such as water, oil, chemicals, and electricity. There are different types of burns: first degree burn, second degree burn, and the third degree burn. So let's study them in detail. First degree burn. It involves minimal skin damage and it is also called as superficial burns. The prevention for it are soak the wound in cool water, use an antiseptic ointment, loosely cover the wound with a gauze. Second degree burn. It damages the top layer of the skin and causes blisters. The prevention for the second degree burn are soak the wound in cold water for 15 minutes, use antiseptic ointment on blisters. Third degree burn. It is the most severe and can damage the skin deeply, can damage the tissues and the muscles very deep. The prevention for the third degree burn are do not use water or ointment, consult the doctor immediately. The next emergency is fracture. Fracture is a break in a bone and most common in children and adults as the bones are weak. There are two types of fractures: simple fractures and compound fractures. Simple fractures. It is also called closed fractures. They refer to the broken bone in the body and do not penetrate the skin. They are caused mostly by falling down. Compound fracture. It is also called open fractures. Here the bone breaks and the fragment sticks out through the skin. The symptoms of the fractures are pain, swelling or the bluish coloring around the wound areas, deformity of the bones. First aid for the fractures. The broken bone requires the following immediate medical care. Number 1. If the person is not able to move some part, do not move the affected area or injury. Apply ice pack over it. Number 2. Place a sufficient padding around the injured area. Use towel, pillow or blanket. Do not massage the injured area. Call the ambulance in case of compound fracture. Clean the wound and tie a gauze. The second situation we are going to discuss is bites and sting. When the insects bite or stings, the venom causes the swelling, red, itchy, and a painful marks on the skin. There are different insects which give the stings and they are left inside the wound. The insect bite. It can cause sometimes become infected. The symptoms include pus around the bite, swollen glands, and the swelling and the redness. Insect sting. The bees, wasps sting causes a sharp pain with the swollen red painful marks. As these insects leave the sting around the wound, they pull out the sting very carefully. The first aid for the insect and the sting bite. Number 1, ice pack. Number 2, pack of banana peel. Number 3, rub the cut onion or a onion juice. Apply cider vinegar. Use cool tea bags. Turmeric, aloe vera gel can be also applied near the snake insect bite. The crushed tulsi leaves. Which the tulsi is the most common plant found in every house. It can be used for the insect bite. The next emergency we are going to discuss about is snake bite. The snake bite is more dangerous than insect bite. It results in the two punctures wound from the snake's fang. The symptoms of snake bites are different according to the types of snake, but mostly includes bleeding from the wound, blurred vision, burning of the skin, fainting, faint marks, fever, and rapid pulse. The first aid for the snake bite. Stop the movement, all the movement. Apply a pressure bandage from the end towards over the bite. Number 3. Splint the limb. That is, you can use a rod or a plywood to stop the movement of the injured part. Get Go to the hospital and call the by calling ambulance. There are certain do's and don'ts about the snake bite. Do not take the patient to the tantric or a snake charmer for treatment. Do not suck the wound. Do not cut the wound open. Now do's. Do immobilize the affected limb. Do apply basic first aid. Wash the wound with soap and water. The next emergency is the heat stroke. The first aid for the heat stroke are move the person in a cool place away from the direct sunlight. Have the person lie down with the feet elevated. Remove the person's unnecessary or tight clothing. Apply a damp cloth or ice packs to the armpit, knee. Give water and fan him. The next situation we are going to talk about is fainting. The first aid for the fainting are lay the victim down on their back, ensure they get plenty of fresh air, apply the cold compress to the forehead. Mostly they will regain the consciousness almost immediately. If there is some timing is taken, you can immediately call the ambulance and seek the doctor's attention. The next emergency is nosebleed, which is very common in the children. The first aid for the nosebleed are make the patient sit up, make him breathe through the mouth, hold the nostril pinch for 5 minutes, warn not to sniff or blow the nose for a certain time. If the bleeding continues, refer to the doctor. So, student, thanks for watching the video. Please do like, subscribe